temperature, proprioception, which is the ability to know where you are in space, your body position. And finally, nociception, which is pain. So there's many conditions that affect the sensory system. And we may be treating someone for a back problem, but they may be a diabetic. So diabetes, along comes with diabetes is peripheral neuropathy, which is numbness or reduced sensation in the hands or the feet. And that will reduce one's sensation. Also spinal injuries. You could have a herniated disc, that can reduce your balance because you could have numbness. And finally, ankle injuries. Ankle injuries, when they come to physical therapy, we work on range of motion, we work on strength, but we also work on restoring the proprioception, which is the balance. So again, this is how the sensory system plays a part in balance. So we've talked about vision, we've talked about sensory. So the next one is kind of the focus of the talk today, is the vestibular system. And the picture there, I don't know if you can see it well, it's a small picture, but it's basically a close-up of your inner ear. And the vestibular system is located, it's a sensory mechanism in the inner ear. It detects movements of the head and controls your balance. So what you see here is called the labyrinth of the inner ear. And the blue part right here is called the cochlea. The cochlea is the peripheral organ of the auditory system. And then, if you see at the top of it, it says semicircular canal. Those canals provide sensory input for experiences of rotary movements. And we'll get more into that when we talk about vertigo. And finally, the last two that you see here, these two sacs, are called the utricle and saccule, and they are the otolith organs in the inner ear. They house these, if you could see the point right here, they house what's called otoconia. Otoconia are small crystals that are found in your utricle of your inner ear. Okay, so let's talk about, this is the most common type of vertigo. It's the most common problem in the vestibular system, and that's BPPV, which is a mouthful. It's benign paroxysmal positional vertigo. And it's thought to be due to debris which is collected in the inner ear. The debris, like we talked about, is ear rocks, or they're otoconia. Now, these otoconia are small crystals of calcium carbonate that are derived from that utricle, that sac that I just showed you. So what happens in BPPV is these otoconia are dislodged from that utricle, and they cause dizziness when they go into the semicircular canal. So again, we'll get into why it happens, but these crystals are getting dislodged from where they should be. They go into the canal, and let's talk a little bit more about vertigo. It's a rapid onset. When it comes on rather quickly. And it's related to head movement that's related to gravity. The key finding, and the key thing that you can almost tell that you have BPPV is that it lasts less than a minute. That's how we determine, if it's BPPV. That's almost the most important question we ask. How long does the vertigo last? Because if it's hours and days, guess what? It's not BPPV. BPPV does not last that long. Okay? So, so how do we diagnose it? How do we know it's BPPV? We do a test that I'm going to demonstrate in the next slide. It's called the Dix-Hall pipe test. And what it does is it produces a certain type of eye movement, which is called nystagmus, and the eyes rotate. So what I thought would be interesting, I'm going to show you that eye movement with a little video. Just look at, you'll see it. See how that eye is rotating? Did everybody see that? That's what we see when we do this test on you. We see your eyes moving and rotating. And that's what makes you feel like the room is spinning. Okay? We're going to get into that, but the test we do is called the Dix-Hall pipe test. And we're going to get into the upper movement.
Is that the same as the DNG?
No. the next slide. So symptoms of BPV. What are you going to tell me, or what are you going to tell your doctor that's going to make us think that you have BPV? Again, you're going to say you're dizzy. You're going to say the dizziness lasts less than a minute. You're going to say you have vertigo. People say different things. They describe it differently. Some people may say they have lightheadedness, imbalance. You know, what's interesting is the nausea that comes along with it, because it's a stomach problem, but it's the reaction to the vertigo. So a lot of people get nauseous when we do a maneuver or when they get the vertigo, and that's completely normal. The other thing people describe is what's called top shelf vertigo, which is when the head goes back, like if you go to a beauty parlor, or you get dental work, or you're working under a car. And that's another common symptom of BPPV. But one of the most key findings is that when you're getting out of bed, or you're rolling in bed, that's when you get it, okay? So, you know, many of you wonder, you know, why do I get it, or why do I have it? You know, why does one get BPPV? And there's a number of reasons. One is that utricle we talked about, that part in the inner ear, can be damaged by a head injury, infection, or a disorder of the inner ear. So trauma, like a head injury or a whiplash, is one way that you can get it. There is a strong association with migraine headache. I don't really know why, but there is, and you don't see it with everyone. Sometimes, just as we age and we get arthritis in different joints, the inner ear also will have degeneration. So as we age, more people have BPPV. Viruses can also affect the inner ear, occasionally following surgery or dental work. Finally, the last two things, medication. So if you're put on an antibiotic called gentamicin, that can cause ototoxicity, which is basically a toxic effect to the ear, and cause BPPV. And finally, 50% of people, it's idiopathic. We don't know why you get it. We can fix it, but we don't know why you get it. So I think that's interesting. So, you know, really, I really enjoy treating this condition because it's so successful. The treatment is so successful. 80% of people get better with one visit. I have probably 2 or 3 people here tonight that I've done it on that, you know, have gotten better with one visit. And I've done it, I've been a physical therapist for 14 years, so this is something I've done more and more of through the years. So it's rewarding to get a patient better that quickly. If I'm treating you for back pain, I'd love to say I get you better in a day, one visit, but you know, the honest answer is back pain is complicated and it doesn't get better. Most things do not get better with one visit. But if you have this certain type of vertigo, and certainly there are other things that cause vertigo that we'll get into, it is very successful. It's a very successful treatment. So the first thing I tell the patient is that this is what we're going to do. I'm going to show you what we're going to do. I'm going to demonstrate it. You know, I always demonstrate it for the patient because I don't want to take their head off the table quickly and they're like, what are you doing? You know, and that you're going to get dizzy. And people are like, I don't want to get dizzy. I'm coming to see you because I'm dizzy. But in order to have a successful treatment, you need to get dizzy. So, so what we're going to do is we're going to actually demonstrate the test that we do, which is called the Dix-Hall-Pike maneuver. And somebody asked about the Epley. We're also going to do the Epley maneuver, which is the treatment. So the Dix-Hall-Pike is the test, the Epley is the treatment. Some contraindications as to why I might not do this Hall-Pike test on you would be if you have vascular disease, if you have occluded arteries, or if you have severe neck problems, because I need to get the neck into certain positions, so I need to know your medical history before I can tell you, you know, if you're a candidate for this. There are some modifications that we can do to these maneuvers that, you know, to accommodate some patients. So why don't we demonstrate the test first, and then we'll demonstrate the treatment. So, John, if you could just put that on.